Sumatra, one of the outer islands of Indonesia. The unique melody comes from the salawang, a traditional Sumatran instrument. The equator cuts across the middle of the island. The Barisan mountain range runs from north to south. The scenery around here is beautiful. These are stretches of burn fields. People here make the best use of natural conditions in a primitive yet original way. There are many kinds of plantations in this district, including rubber plantations. The people get oil from palm fruit. In these spacious plantations, the people grow various crops, tobacco, coffee, and so on. We happened to meet a wedding parade in one village we visited. The bundles these women are carrying on their heads are wedding gifts. The bride's family accepts the bridegroom. It's a village custom to show the couple's bedroom to the neighbors. Our story takes place in Sawalunto, a coal mine town about 100 kilometers from Padang, the center of West Sumatra. This town, with a population of 13,000, was founded by people from Java who had been forced to settle here toward the end of the 19th century during the period of Dutch rule. There are still old houses and other buildings in the town, vestiges of the colonial times. We saw an 1895 model locomotive carrying coal every day to Badan Harbor. It was here in 1975 that one day a coal miner was brought into the mine's dispensary. The doctor found that he was anemic, anemia caused by hookworm infection. His skin pale, palms whitish, nails somewhat warped. Doctors knew that many other coal miners had similar symptoms, anemic and always very tired. It's very warm and humid inside the mine. There's no latrine there, an ideal environment for the millions of hookworm larvae that thrive here. Miners go barefooted. so larvae can easily enter their bodies through the feet. The symptoms of hookworm infection are anemia, extreme fatigue, severe palpitations, and so on. Fortunately, the mining company, with the cooperation of the Ministry of Health, conducted for the first time a mass examination of the miners and their families as an initial parasite control step.
Nomor 6. Apa isi berak apa setengah iko. Sudah tu bisa sebelum jam 7 apa kumpul di siko.
Everyone concerned had their feces examined and their blood tested. Surprisingly, hemoglobin tests revealed that nearly 70% of those examined were anemic, mostly because of poor nutrition. As a result of the feces examination, it was discovered that 80% of the miners had hookworm infection, which aggravated their anemia. A large number of the children were found to be infected by ascaris rather than by hookworms. Ascarids are called roundworms.
Cacing ini hidupnya di dalam usus halus.
Occasionally, lectures were given at the miners' meeting hall where the staff of the health center explained the life cycle of parasites.
Setiap cacing betina dapat mengeluarkan telur kira-kira 9.000.
Hookworm eggs in feces evacuated on the warm ground develop into larvae, which then find their way into the human body.
Nantinya manusia bersama-sama keluarkan. Jika orang itu buang air.
Hookworm larvae are almost invisible. Once they get into the human body, the larvae begin to use nourishment from the host system and grow into adult worms, all the time adhering to the intestinal wall of the host. As soon as the conditions of the mine workers were discovered, the mining company in Sawalunto started campaigns to eliminate parasitic infection. First of all, the company began mass treatment of the infected patients. It was carried out every 4 months. The company paid all the expenses involved. The company supplied the workers with overalls and shoes. That proved very helpful in interrupting the life cycle of hookworms. The company also encouraged the miners to study preventive care, and they provided the workers with facilities where they could clean up after work. Parasite control programs launched by the mining company helped miners' families, wives above all, to realize what the campaign really meant. Midwives at the clinic routinely helped with family planning and childbirth, but they also began to take part in the parasite control program. This has helped mothers become more and more interested in family planning. Health and nourishment have a great deal to do with family planning. Following the company's example, hospital authorities in Sawalunto recruited and trained field workers to become a new force to assist in parasite control and in family planning. The movement grew rapidly thanks to the help of field workers recruited from the same district. Their devotion to work helped the campaign to spread to neighboring villages. About 20 kilometers away from Sawalunto is Talavi. Talavi is known in this district for its maternal society. The inhabitants are called Minangkabau, the most populous race in Sumatra. The village is also known for the traditional houses called rumah gadang that remain even today. After a training course in Sawalunto Hospital, one of the field workers began to live in a rumah gadang house. She visited from house to house in the village on a bicycle every day. Field workers are encouraged to concentrate first on establishing good relationships with villagers. They helped the sick to visit the hospital or recommended a doctor or a midwife, and if necessary, tried to send a doctor to patients' homes. The motivational approach to a family depends on the situation. One field worker began with a talk on helminths, then proceeded to the children's health, sanitation, personal hygiene, and then family planning. There were parasite hotbeds everywhere in the village. Children relieved themselves anywhere that was convenient around the house. There were no latrines. In the tropical warmth and humidity, hookworm eggs hatch well. Hookworm larvae are everywhere. Rivers polluted with human waste help spread infectious disease. At a primary school in Talavi, a mass examination of feces was carried out with the cooperation of villagers and field workers. There was a high percentage of ascarid infection among the children. The main reason is that they didn't wash their hands well. Some of the young children in particular ate things they found on the ground. Mass control of ascarid infection provides a good chance to educate children about sanitation. Today at school, people from the health center are showing the children samples of ascarids to help them understand the harm parasites can do.
Lihat, semua kan? Ini adalah cacing gelang. Udah pernah keluar dulunya waktu makan cacing? Siapa yang paling banyak cacingnya? Gini ya.
The microscope helps them to understand. Worms keep laying eggs in a child's stomach, so countless worm eggs are found in the feces. Grown-ups are also welcome here. It's a good chance for them to learn too. Curious soldiers stationed in the village want to try the microscope. They've never seen one before. Villages have their own social codes which have been observed for many centuries. One old proverb goes, Social customs survive the heat and the rain. When promoting family planning campaigns, one must be familiar with village customs and manners. In the maternal society of Talavi, women live together in the same house, grandmother, mother, and daughters, one eventually inheriting from another. At home, maternal uncles are responsible for the education and discipline of children, while father takes care of his sister's children. There is a traditional institution among the villagers called Mini Mama, a traditional setup organized by uncles. Mother is the head of a house, but if something serious happens, uncles must deal with it while making much of mother's opinions. Uncles would also offer financial assistance when their nephews or nieces need some help. For example, when they go to school, get a job, or get married. Only girls stay home. Boys go to stalls like this or little mosques. These young people live together here to train themselves, to strengthen their spirit of independence. It's only a small village, but there's a fine high school where business is taught. This is because mothers here are education-minded and want their children to be well-educated and financially independent. When boys reach a certain age, they begin to work away from home, a custom still observed today. Another proverb says, "Don't spare the rod if you love your child. If your son loves his village, make him travel." Many young men go elsewhere to work, so monkeys are used to harvest coconuts. The field workers produced a play for village audiences. There's not much entertainment in the village, so a project like this appeals to the villagers all the more. Here's an outline of the story. A family with many children quarrels every day. Children must be well educated because they must compete in society. But the parents can't afford to pay for the educations if they have too many children. This story seems to convince all the mothers. These activities helped Talavi villagers change their minds about some things. For example, they now think it's necessary to have latrines. The young staff of the health center has learned how to make a toilet with a little cement. They made several for the villagers. It's a matter of individual taste to decide on the kind of roof, walls, and so on. There are many different customs in Sumatra. This is the village called Tanah Kero, near Lake Toba in northern Sumatra. We found life quite different here. The inhabitants here are called Batak. They live in traditional houses known as rumah adat. Not a single nail is used in any part of the structure. The roof symbolizes a buffalo head. Most people here worship animals, but we also found quite a few Christians. At least 8 and sometimes 12 families live together in these huge houses. We entered the house and found 4 hearths for 8 families built on elevated floors. Each hearth is shared by 2 families. The hearths also serve as borders between families. We see women and children here, but this is a paternal society. Men with the same grandfather live in the same house. They accept wives here from another family. We saw women living in the same house working on the farm in accordance with the communal system called aron. Long ago, men stayed home to defend the village. The old custom remains, but now it's to do housework and care for the children. The women must go out to work, so they can't afford to have too many children. Since the old days, village women have been practicing abortion in their own way by using a plant called tengkwa. But this traditional means of abortion involves excessive bleeding. It's unsanitary and it's dangerous. The health center in this district tries to convince women to stop using tengkwa. Doctors and midwives visited the village women when they returned from the farm and taught them to use a safe method of birth control, recommending the IUD. In any country where poverty is prevalent, women would like to have no more children. In a family planning campaign, be sincere with them, and they will listen to you. If you're too hasty trying to convince them, they will only grow suspicious. On the northern extremity of northern Sumatra is Banda Aceh, where Islam took root among the people in earliest times of Indonesia. We visited the town the day the annual festival was held, the festival called Haji. Girls studying the Quran. Generally, religion is considered a hindrance in teaching family planning. But in a village near Aceh, a religious leader was playing a significant part in modernizing his village. In a tradition-bound society, it can be advisable to seek assistance from religious leaders in carrying out a family planning program. In Tel Aviv village near Sawalunto, people made 728 new latrines after 2 years of combined efforts in parasite control and family planning. Water serves the same purpose as bathroom tissue in this area. To save precious water, the owner of this house hit on a good idea. He makes use of rainwater for that. An increasing number of mine workers in Sawalunto have private latrines lately. Drinking water is always important. In Tel Aviv, 38 families have switched to pump wells. They have covered up the open wells for sanitary reasons. Here's a clever man. He extended a pipe from the well into the house, so the family has water inside the house. People have ideas and energy to improve life. We met villagers building a simple water course to draw water from the riverhead. Children in Tel Aviv now wear shoes or sandals when going to school. The young health center staff is raising vegetables in the backyard of the hospital. Nutritious vegetables such as tapioca and soybeans, and other vegetables rich in iron. They encourage the villagers to try it to attract attention to better nutrition. Soybeans are cheap and always available in Sumatra. At miners' living quarters, it has become fashionable among housewives to make tempeh, steamed and fermented soybeans. Tempeh is a traditional food high in nutrition. These days, people better understand nutrition. They enjoy tempeh at home, but they can also make some money by selling it at the market. This man invested in the equipment needed to make bean curd. The couple started it as a side job, but now it brings them a greater income than the pay he gets from the coal mining company as a mechanic on night duty. In addition to the traditional pasar, there is a kind of cooperative where people can buy daily necessities at reasonable prices, and if necessary, they can pay at the end of each month. At the Sawalunto coal mine, absenteeism has decreased significantly. Production has increased, meaning greater profits, enough for the company to recover its expenditures for parasite control. including the cost of shoes and overalls given to the workers. Parasite control statistics for the past 3 years in Sawalunto. We notice an obvious decrease of infection with great increase of hemoglobin in blood. Meanwhile, participants in family planning in Sawalunto have increased more than the average in West Sumatra. The day we left Sumatra, Talavi village had the first supply of electric power from the mining company's generator. How delighted the children were. At the moment, there's only one TV set, but it's working perfectly and very popular.
Tapi nilai-nilai dari mana? Pikiran dia sendiri. Padahal yang kita kira itu bernilai, di sisi Allah tidak ada nilainya. Maka nilai yang...
Minangkabau is the land I love, the heritage since the remotest days, handed down to us by so many mothers. This old song is associated with the traditional house of Rumah Gadan, but these houses too are gradually giving way to modern ideas. At the same time, many people in the village join the movement to conserve these time-honored houses. A young mother is singing a lullaby in one of the old houses. Mothers in any country have the same wish for their children. They want to bring up healthy children and educate them well. Here in Sumatra, the people's beliefs and attitudes are gradually changing, like this water mill, always moving, slowly but steadily.